Guyana has got a very great relationship with the Peace Corps volunteers, and so we're very happy to have a new set of you here to serve willingly in our beautiful country. In order for you to get a great understanding of our public health sector, and more importantly with an emphasis on regional, what happens within the regions, I would like to present none other than the Director of Regional Health Services, our very own Dr. K. Shako, to come and give you an overall overview of the public health sector with an emphasis on the regions.
It gives me great pleasure this morning to be a part of this welcoming ceremony of our 21 Peace Corps volunteer. And I'm also happy to say that it is good to be a volunteer. It doesn't matter in which area you are. And I can see your, you have a quote here for a person who volunteers. It says, and I'd like to read it even before I start, a volunteer is a person who can see what others cannot see, who can feel what most do not feel. Often, such gifted persons do not think of themselves as volunteers, but as citizens, citizens in the fullest sense, partners in civilization. And I always feel that volunteers, they are a special kind of people. And we all, at some time within our lives, were volunteers. So let me say how happy I am to be part of this ceremony to welcome the 21 Peace Corps again. Well, as you know by now that Guyana's health system is pretty complex, but I would like to start you off with our Constitution, which says that every citizen has the right for free medical attention and also to social care in case of old age and disability. Now, our health system is being governed by what some persons call the Bible, Health Vision 2020. And within our Health Vision 2020, it outlines universal health coverage, as well as our primary healthcare model. That is what our healthcare is being based on. And within our Health Vision 2020, it says that all people and communities have equitable access to comprehensive and guaranteed quality services that they need throughout the life course without financial hardship. Our vision is that all people in Guyana are among the healthiest in the Caribbean as well as in the Americas. Now, we also target a tripartite goal, which speaks to the fact of advancing well-being of all people in Guyana, reducing health inequalities, and also improve the management and provision of evidence-based people responsive. Now, I would also like to start by telling you that the health system in Guyana is not primarily managed by the Ministry of Public Health, but it's managed by the Regional Democratic Council, as well as the Ministry of Local Governance, and that is where we receive our finance from. Also, we have a complex healthcare system. You would have heard me starting off with that. We have the primary level, we have the secondary level, and we also have the tertiary level of care. In our primary healthcare system, we have the health posts and the health centers, which are regarded as primary. And in those areas, for example, our health posts, we have mostly the community health workers that are being stationed there. But then, because we've been revolutionizing and revising our healthcare system, what you find is happening, because we want to ensure that there is equity and equality of healthcare across the 10 administrative regions, you will find that few of our health posts, they're being either managed by a doctor or it may have a visiting doctor. And it's because of the terrain in Guyana. Now, our health centers, the ministry have undergone an expansion program whereby most of our health centers, about over 90% of our health centers, they're being managed by a doctor. Previously, our health centers had like medics and midwives. Now, when we come to our secondary health care, we have our district hospitals as well as our regional hospitals. In our district hospitals and regional hospitals, we start with our basic level of health care. And what we're saying to the Guyanese people is that at least 4 basic healthcare services are needed within these areas. So those healthcare services, specialist healthcare services, they are obstetrics and gynecology, pediatrics, general surgery, and internal medicine.
I'd like to thank you all very much for inviting us here this morning and for such a gracious and warm welcome. We were very sorry to be late. We came down from the Essequibo, this group of 21 new Peace Corps trainees, got up at dawn, got in a bus, came down, came across the Essequibo River, got in another bus, came across the Demerara, got in another bus. This is a part of Guyana they've never seen. They arrived in the dark, and they were whisked off to the Essequibo, so it's fantastic to have them finally see a little more of the country. And I was so amazed during your remarks to hear, because I know the kinds of places you were describing, the kinds of situations within the health system, from a health post to a regional health hospital to one of your larger hospitals, to know that some of these volunteers will be placed in all of those locations, and they all will have a very, very different and interesting service here in Guyana. But we are so grateful for your partnership in this effort. The Peace Corps has worked with the Ministry of Health for many years under a memorandum of understanding, which has us working in various areas, including some of those which Dr. Shako mentioned, maternal and child health, in lifestyle behavior change particularly. And these volunteers, now trainees, are about to undergo 10 weeks of training in lots of subjects having to do simply with volunteering and with development, but also very specifically about health and the health system. So we are eager to have your partnership in this. The trainees come from all across the United States, from almost all states. Their backgrounds range from public health to sociology to nursing. They've either completed their BA or in some case their master's degree. They are accomplished, they are eager, they are curious, and I think they are coming with incredible energy and a desire really to serve. Being a Peace Corps volunteer is about service. It's about 2 years of your life that you give to be in another country, to be part of another system, to learn, of course, about yourself, because so much of it has to do with the sharing that goes on in those situations. But they really stand to gain an enormous amount to see how this health system here in Guyana works and to understand a little bit about some of the most pressing problems in the world today that as healthcare professionals or as development professionals or whatever they choose to go on and do from here will in fact shape their outlook, I think, forever. To see what it really means to be struggling with a lack of resources, perhaps things like malnutrition, all kinds of diseases, tropical diseases, which they are probably unfamiliar with in their own areas. There's so much opportunity here to really see how others in the world live and to bring to it their own, I think, richness and background, and mostly compassion. That's what we're hoping we're deploying here, is a great squad of compassion and usefulness to you all. So I too will make my remarks brief, just to thank you again for your partnership in this effort. We look forward to working with all of you and look forward to a great 2 years with this Peace Corps group. Thank you.
Peace Corps, you are here in Guyana. A very good morning to you all. Well, my name is Dr. Karen Cummings, and I'm the minister within the Ministry of Public Health. It's indeed a pleasure and an honor for me this morning to bid you a warm and sincere welcome on behalf of the Minister of Public Health, Ms. Valda Lawrence. The Ministry of Public Health is currently engaged in numerous programs aimed at ensuring that Guyanese people are among the healthiest in the Caribbean. Prior to my coming here to the podium, you've heard from the Director of Regional Health Services as she elucidated all that's happening, an overview of the different regions, our 10 administrative regions. And I want to let you know that we do have some challenges. As you know, we have problem with our NCDs, non-communicable diseases. It takes up 70% of our budget, and so we have to work on that. We also need to work on our mental health department and our suicide rate. We're still the highest in this part of the hemisphere, and so that's a challenge, and it's a work in review. Our maternal mortality, we have reduced somewhat from last year to this year, but it's still a work in progress. And even though our MDGs, goals 4 and 5, was a little bit elusive, we are working head on to ensure that our sustainable development goals, especially goal 3, that we ensure that there's well-being to all our members of this beautiful Guyana. This ministry works collaboratively with other ministries. We cannot do it alone. And so we need the other stakeholders and partners to come on board, both nationally and internationally, to ensure uncompromising quality health care services are delivered equitably to all persons living in Guyana, as we narrow the inequities between the hinterland and the coastland. The Peace Corps work in Guyana have been here for over the years. We've seen them in various sectors. Guyana has benefited in great ways from the work done by the Peace Corps volunteers. Of significance is that throughout the years, the work done by the Peace Corps volunteers in the public health sector is commendable and noteworthy. A rich legacy of exemplary work done by those volunteers who preceded you means that you must give of your best as you aim to maintain the high standards established by your predecessors. Let us work together to significantly improve the lives of the citizens of Guyana. The work you do here will touch the lives of many. Your volunteerism must be predicated on love and respect for humanity. Together, let us work to strengthen and deepen our relationship. I want to encourage you volunteers. Guyana is a very beautiful country with beautiful people. Do enjoy your time here wherever you are placed. You must establish the kinds of relationship that will help you to function in a professional manner in your particular area of placement. You must also bring to bear your knowledge and expertise so that you will be able to do your best. Guyana will become your home for the next 2 years. You need to make it the best of it by embracing the different landscape and cultures. I can assure you that this time you will spend here will be very different, yet very refreshing and positive experience. You have the opportunity to grow and expand your horizons as you develop new skills and coping abilities. As I look around the room today and see your faces, I realize that each face tells a story. So many faces, so many stories. You come from many different backgrounds. You have many different life experiences. And yet you all have at least one thing in common: your willingness to give your time to help others. And that's commendable. It takes a special person to make this kind of offer. We applaud your commitment. I am humbled by your generosity of spirit and your compassion for your fellow human beings. It is all of you who would so generously give your time, your warmth, your humor, and your caring that contribute to make this world a significant and better place. The Ministry of Public Health is confident that you will make an incredible contribution to the Guyanese society through the work you will be doing. We do hope that your generosity of spirit and commitment to the improvement of humanity will help to overcome many challenges, or any challenges that you might encounter in your new environment. So, without much ado, I want to welcome you. On behalf of the Minister of Public Health, Ms. Valda Lawrence, and the rest of the hard-working staff of the Ministry of Public Health, I officially welcome you, the 2017 batch of Peace Corps volunteers, to the Ministry of Public Health. I will leave you with a quote from Sherry Anderson: "Volunteers don't get paid because they are worthless, but because they are priceless." Best wishes.
My name is Jamie Herring. I have a background, master's in anthropology, but I also volunteered in a domestic violence shelter, along with some suicide and crisis calls, and also volunteered at a pregnancy resource center.
So what are your expectations?
Expectations while here? Well, right now I'm just trying to learn as much as I can about the culture and just everything that we'll be doing. We just started to separate into our own health sector versus education sector, so I'm just trying to take in as much as I can right now. So my expectation is to learn at this point and kind of keep it broad and open for what to expect in the future. So, thank you.
My name's Lee Hendricks. Yeah. I'm in the health field, so I just graduated with my undergraduate degree, my BA in biology, and my focus is on pediatrics. So, yeah.
What are your expectations being
Um,
working in the sector?
I think that the biggest expectation I have is just learning how to integrate into a community well. I think that building that trust is so important between communities, especially international communities, because before I can even give my piece and give my knowledge to the people of Guyana, I've got to have them trust me first. So I think that's going to be an interesting experience for me.